Diabetes is often referred to as joke disease, wasting and thirsting, by Chinese medicine practitioners. Joke suggests thirst, hunger, and frequent urination, as well as muscle wasting. While there is some overlap between joke and diabetes, the two terms are not interchangeable with one another. Joke is most similar to type I diabetes, but type 2 diabetes is more typically a disease of diet and lifestyle overindulgence, and the patients do not usually experience the wasting and muscle atrophy. Treatment for diabetes is similar to treatment for joke, but there are more factors that need to be taken into consideration when treating diabetics. There are several classic formulas to treat joke, depending on whether it primarily affects the upper, middle or lower jaw. The classic formula to treat upper jaw joke is Beihutang, Yunujian or Qingwei San are used to treat middle jaw joke, and Liuwei Huangwan is for the lower jaw. However, use of these formulas alone will not be sufficient to treat diabetes, because as mentioned before, diabetes is more than just joke, it also involves complications of eyes, blood vessels, infections, neuropathies, and nephropathies. Therefore, in order to effectively treat diabetes with Chinese herbal medicine, it is essential to choose the appropriate Qiao formula, and then add herbs for blood sugar control and address complications from the diabetes. There are many anti-diabetic herbs in the Chinese Materia Medica, or herbal remedies for diabetes, so choosing the right herbs for the patient just comes down to whichever are the most appropriate for the presenting pattern. Zimu, Rhizoma and Marini, and Huangqi, Radix astrigle, are among the most commonly prescribed herbs to treat diabetes. Huangqi has a marked effect to lower plasma glucose levels and alleviate insulin resistance. The anti-hyperglycemic action of Huangqi appears to be due to increased production and release of insulin. Zimu, which also has an antidiabetic effect, has the benefits of increasing insulin secretion, decreased insulin resistance, and prevention of pancreatic atrophy. These herbs are great to include in an herbal formula for a type 2 diabetic patient, but if a patient has type I diabetes, which is more similar to joke, the pancreas is no longer functioning, and so herbal medicine treatment can really only be targeted to manage complications and signs and symptoms. In order to treat complications and manifestations in the diabetic patient, it is important to remember that most problems that are occurring are due to the fact that increased viscosity of the blood due to hyperglycemia leads to poor circulation. Therefore, it is a good idea to add some blood-moving herbs to the formula to make sure that the medicinal compounds are able to make it through the circulatory system and get to the diseased areas. Danshen, Radix et Rhizoma, Salvia miltarizi, is the perfect herb to accomplish this, as will open up the blood vessels, bringing blood to the periphery, and acting as an envoy to treat diabetic neuropathy. Using a small amount of herbs that invigorate the blood should be essential in the herbal treatment of any patient suffering from diabetes, and will increase the efficacy of the herbal formula used to treat their presenting pattern.